Welcome to the fourth and final session in Course 3 of EDS Awareness Nursing Continuing Education Program, What the Nurse Needs to Know About Ehlers-Danlos Syndrome. Let's hear some final thoughts from Maddie.
So Maddie, from your perspective, what is the best way that a healthcare provider could help you and your family?
Honestly, just providing as much knowledge as they can, as many resources as they can, and just ensuring that they know that the family knows that they are being heard and not just pushed off to the side. Um, Even if they can't help, or the provider, if they can't help directly, um, just make sure to make sure that the patient knows that you understand that their symptoms are very real and what they're going through is very real, and that they're not crazy, and offer up different providers that can possibly help them um, more with what they're going through.
What one thing, if or more, has a healthcare provider done in your experience that has made what you're going through more difficult?
I've had a lot of bad experiences with providers. I've had providers tell me to dislocate joints on the spot to prove that it happens. I've had providers basically make me feel like I'm a circus freak in one instance, or downgrading my symptoms, or making me feel like, oh, it's not a big deal. There are several people that go through this and are still able to do things. Um, so one of the most harmful things that a provider can do is like I said, basically have a box that they want their patients to fit in, have a list of symptoms that they expect them um, to experience, and if they don't fit into that box, then they disregard them and they say that they're crazy, or they tell them that they're being dramatic, or that their experiences are not valid. So it's very damaging to a patient when you make them feel like if they don't fit into a box, that they need to.
Have you had much experience with providers who know much, if anything, about EDS?
That's a hard question because there's not going to be a provider that has a lot of experience with EDS. Even EDS specialists haven't seen it all. Um, Even people that have had several patients with EDS, um, their number is still, they'll say, I've seen several. Okay, well, how many is several? And they'll say, well, probably 5 or 6. Those 5 or 6 patients are going to be very different in each case. So um, I would say no, I haven't had a lot of experience with providers that have experience with EDS, because there's no such thing as being an expert on EDS. You can be as well versed as possible, but it's a disease that you don't really know a lot about, and so there's always more to learn.
Would it be helpful to you if nurses and doctors and other healthcare providers um, did what they can to learn more about this, and at least were aware that this disorder is is real and is out there?
Yeah, I think that as much information is out there right now, people need to be aware and they need to be educated in it, because um, I am very fortunate. I have a family that's very supportive, and I have um, faith that has gotten me through, and I'm very I'm okay. but there are some people and some patients that are just not okay. And that's to no fault of their own. They've been made to feel like they're crazy and they've been beaten down. And it's because people are not educated, and it's because people don't take the time to look at every scenario. Um, so I think that doctors need to go in with the mentality of, I'm not going to know all about this disorder. I'm not going to know everything, but I can know enough to help the people that are facing it and struggling with it. Um, so just knowing that you're not going to be an expert is one of the biggest things from a patient's perspective. But knowing enough and being willing to learn is huge.
What is one thing that you wish that someone had told you when you first started all this? Expect this, or this is a resource that will be helpful for you, or anything that would have been helpful to know at the beginning of all this?
Expect to not know what to expect. There's not been a single instance where I have known what to expect with this disease or disorder. It's unpredictable, and I think knowing that it's so unpredictable going into this would have been very helpful, because each day is going to be different. You're not going to know what to expect, and it's going to be very difficult to know what to expect. But here are a list of resources. So here are groups of people that have gone through similar things, not the same things, but very similar things, and here's what they went through, and here are the resources that they used. So using things like that, and group chats and discussion boards and things like that was very useful. But the biggest thing is just to make peace with not always knowing what to expect.
During this brief time together, I hope you've learned from Maddie's story. There really isn't only one way to advocate. Webster defines it as one who pleads the case or cause of another, one who defends or maintains a cause or proposal, and one who supports or promotes the interests of a cause or group. I love these definitions. Over the past few years, I've pleaded, cried, and defended my daughter with other EDS patients. I have believed her when nobody else did and insisted that others take her seriously. I have researched, called, emailed, and networked. I believe my daughter is better for it, and every EDS patient deserves healthcare providers that will do the same for them. The American Nursing Association believes that advocacy is a pillar of nursing. Nurses instinctively advocate for their patients in their workplaces and communities. In doing so, we ask that you always start with believing your patients. This one thing would have saved us so much emotional pain. We also ask that you treat everyone individually and understand that EDS is unpredictable. It doesn't follow a predictable pattern. Meet every patient where they are and use what you've learned to seek real answers for them. Continue to educate yourself in order to recognize signs of possible EDS diagnosis and learn to give safe and effective care. Share resources and use the advocacy groups to locate treatments and providers. As healthcare providers, you understand you are better equipped to connect patients to those who can help them. While Maddie's symptoms actually manifested around 2005 and escalated in 2011, we had no idea where our journey would lead us or what it would entail. I compare it to the stages of grieving process: denial, anger, depression, bargaining, and acceptance. Each time Maddie had a surgery or a new diagnosis, we thought, this is it. She'll be all right now. Nobody wants to admit that the child has such limitations and is destined to a life of pain. There was much anger, of all the missteps and uncompassionate encounters. It was anger over a life and experience that she lost. There have been profound sadness over losses, the isolation and loneliness that comes with chronic illness. There have been many prayers whispered for healing and to please let me take her pain from her. And finally, there's a peace in accepting that this is the life as it is, and finding purpose in it. Our prayer has been answered in many small and large ways, and she's doing well emotionally. This is huge for someone who has had such trauma and been through so much. So when asked what helped, she said what has helped the most were providers who helped with referrals and resources, and those who knew their limitations but were willing to learn and to help, and those that validated her symptoms and conditions. When asked what made it worse, she recounts experiences where providers made her feel like she wasn't getting better because she wasn't trying hard enough, or patients or providers who basically said to her, "Prove it. Prove that to me that joint is going out," making her demonstrate her subluxations and caused her so much pain and tissue damage. Or those who used comparison to make her feel invalidated or crazy. She wanted you to know that in her experience, there really are no real experts. We're all learning together. Hearing this honesty from providers is very comforting and gives her confidence in their care. She asks that you don't put patients with EDS in some preconceived box. She values those who think outside of those boxes. And finally, she said that it would have helped to know how unpredictable EDS really is. This might have prepared her more for the many changed plans and disappointments over what she thought her life would be like. Maddie has now accepted her life as an EDS warrior and finds joy every day as she learns to navigate the challenges that she faces. Thank you for hearing her story. Please join us in increasing awareness for all of the EDS warriors, because we know that early diagnosis and treatment can and will produce better outcomes.